Hi, I'm Dave Brown with His Space Productions. We're on location at the Veterans Memorial Park in Columbus, North Carolina. As I canvass the names on this memorial, I am reminded of all those who served and dedicated their lives to this country, which is the theme of why we're here today. So thank you. Sit back, relax, and enjoy.
So in my role, I oversee the transportation department, and I'm also overseeing the county's efforts related to the opioid settlement funding. And with transportation, it is one of those services that is essential for many individuals who have issues accessing different resources or services because of the lack of personal vehicles or the ability to pay for vehicle insurance, for example. We also transport a lot of our elderly individuals, and we take them to their medical appointments, we take them to the meeting place. So it's also a way to connect our communities together, connect them to not just those medical and health related services, but also for those events and opportunities that give them a social connection and reduce isolation. In our work, we have spoken to numerous community members. We've held community listening sessions. We've heard a lot about the importance of reducing stigma. We understand that many individuals and community residents feel ashamed to seek help or are made to feel ashamed when they seek help. There's also others who feel like they're outcasts or that they're shunned from society because of these issues that they face. So with this project, we're hoping to alleviate some of that, but also change the culture, change that narrative that it is okay to seek help, that it is okay for individuals to live a quality of life that they deserve by being able to access the services and resources that they need.
I think I agree, and especially in our county's context, we're a small rural county. We all know each other, or a lot of people know each other's business, and that really reinforces the stigma without people even intending for that to happen. We are afraid to seek help because we might see someone we know at a clinic, and we might see someone we know from work at a mental health appointment, and that can be embarrassing. And I think that's important to highlight the impact of the stigma, but also, we don't intend to reinforce it, but sometimes we do. And so kind of opening the conversation around it and saying, our sole purpose at this agency and through the grant that UNET manages is to open the conversation to really promote accessibility and make people understand that we're here to serve you and serve each other and
create those safe spaces.
Create the safe spaces.
My name's Jessica Perkins. I'm a peer support with the Free Clinics. So what inspired me to be in this field was I had my own line of addiction and peer supports with me because I was once homeless and addicted, and I didn't have anyone to turn to. So when I go out on Thursdays and I do street outreach and I bring materials with me, and just to see the hope in their eyes, it really gives me hope. You can become a peer support with the Free Clinics, and it can help by just walking along someone in recovery or being next to someone who's in endocrine clinic with diabetes and they need to know more with it. It's not just substance use. You could be peer support for a variety of things.
With your education now and your passion, do you feel like you're in the right place as a peer support, and why?
I absolutely feel like I'm in the right place. I feel like I'm in the right place by being at the Free Clinics because of all the people, the neighbors we serve, who come through our doors just looking for some extra help, and we're there to help them, hold their hand, walk alongside of them, help fill out paperwork that might be confusing or just feel overwhelming. I wish Polk County would understand that mental health, you don't just wake up with it one day, and you don't just wake up with addiction one day. It doesn't discriminate. It chooses anyone. I was that person. I was that person 5 years ago. I didn't think that I was going to make it through. You could have smiled and made my day better. But instead, people are so quick to judge and to be mean that you don't realize that when someone's having a bad day, it could take a real toll on them. And an addiction is so hard to climb out of that. I never thought that I was going to get sober, ever. I still think about it today and I'm like, wow, I can't believe I'm here. I didn't just wake up one day and decide to drink and choose to do pills. I had a lot of trauma that happened to me in my childhood, into my teen years, into my motherhood. And it hurt me really bad. I didn't have the right resources like I do now. But if I had the right resources, I could have got sober a lot sooner. And that's why I sit here and do what I do every day.
My name is Sherry Pace. I am the director of the RHA Mobile Crisis Team. RHA is a place where humans bloom. Our mobile crisis team serves 11 counties, including Polk County here in Western North Carolina. We are what's called a hospital divergent program, so we are trying to keep individuals out of the hospital. We are an insurance blind program, so we don't care if individuals have private insurance, no insurance, Medicaid, Medicare. It will not affect our ability to provide our service, and nobody will ever receive a bill from us. So we have a crisis line, and individuals can call that crisis line. We have dispatchers similar to the idea of a 911 dispatcher who will take the information that you're sharing and triage that call to then be able to send a community responder out to engage with the individual. We determine in our field of work that crisis is self-defined. So if you're seeing something and you feel somebody needs support, give us a call, let us come out, let us see what we can do to help that individual. But I can remember one case where I worked with an individual, he was an immigrant here, and I would see him at our outpatient office on almost a weekly basis after I connected him as a responder to multiple different services. And every time I saw him, it made my day. To know that he was out there and he was persisting and getting the services that he needed in place. I want them to know that we're here and we care, and we want to support you whenever you feel that you need it. If you just need somebody to talk to and you need that person face to face there with you, we can do that.
Okay, I'm Barrick Morton. I work for RHA Health Services. I am a supervisor of the mobile crisis team that serves this region. A lot of your typical, regular, everyday citizens don't know that mobile crisis is out there ready to serve them. That's really where it falls through the cracks. People would call 911 when they're in crisis. And thankfully, with our relationship with law enforcement likely will divert that to us and say, hey, this is a mental health crisis going on, or a substance use crisis, or IDD, or children's behaviors, things like that we address more so.
The stigma of addiction, the labels, even in this community, that are put on addiction and the mentally challenged.
Yeah, I'm very passionate about what I do. Been doing it for about 2 decades now. And there's a lot of sad stories to come out of that, but there's a lot of good victories that come out of that too. And that's what keeps me going daily.
I'm Kimberly McDonald. I'm a prevention coordinator for RHA Prevention Resource Centers, and we are a division of RHA Health Services. Our primary mission is to reach youth before they start experimenting or engaging with any type of a substance. And so with that, we implement some strategies in our communities. And we do that by connecting with our stakeholders. And some of our stakeholders are the school systems. We have also stakeholders with law enforcement, faith communities, civic organizations, and like our health department that's here. So with that, we engage with those agencies along with parents and youth to come together to talk about how we can prevent youth from even beginning to use substances.
Prevention starts early and often at home.
The need for prevention in Polk County is something that every parent needs to take into consideration, and how to do that is to start having conversations early with your children. Have the conversations about what substances can and can't do to them and how that can change the trajectory of their life.
I'm Rivers Woodward. I'm a family medicine physician and associate chief medical officer at Blue Ridge Health. I have a particular focus in my practice on addiction medicine here in Polk and Rutherford counties. Blue Ridge Health is a federally qualified health center, and how we collaborate with local organizations and agencies is in recognizing that a tiny proportion of someone's health is actually what happens inside the doctor's office. Access to medical care is important, and that's what I do every day, but where the rubber meets the road in terms of what actually makes a difference in people's health and in their lives is, do they have access to food on a regular basis? Do they have access to safe and sober housing? Do they have access to transportation, to work, or opportunities to develop those skills? And so we partner with a lot of organizations to get those things done, both at the Health and Human Services Agency, with the United Way. We do outreach in the community for folks who are in active addiction to try to meet them where they are. We have a program where we deliver fresh produce boxes to folks with food insecurity, and do a lot of work in the community outside of the walls of our medical clinics. Having grown up and lived in Western North Carolina my entire life, what I see in some of our smaller rural counties like Polk is we don't have the resources that you might have up the mountain for an inpatient facility, or to be able to walk into a facility and get treatment right there. And there also is quite a bit of stigma, regardless of what county you're in, but I see that in Polk where people are embarrassed or afraid to start medication to treat their illness because their families told them addiction isn't an illness, right? It's a moral issue, or they hear that mental health is not the same as a physical illness, and they have that fear of going and getting help for these things that the medical system really has a lot of wonderful tools to treat and help people get their lives and their feet back under them. And so I see stigma and lack of access to care, and also just these intergenerational cycles of trauma and the impact that has on one's mental health and their ability to get their lives where they want them to be as an adult. I have a lot of stories from patients of ways that the care that we provide really changes lives. The ones that stand out the most are the folks who were really in crisis when I first met them, and maybe that was someone on our outreach team who met them in the community, and thinking about one person who had a really significant wound on their leg, right? And they weren't ready to stop using. They were there because they wanted it to feel better and not be in pain. And And that was okay, right? The conversation that day was about how do we help you feel better today? How do we respect you as a human being and the fact that you have autonomy over your health and your decisions. And on top of that, we're here in this medical clinic. It's not maybe the scary place that you thought it was. And when you're ready, we're here to help you. And then seeing that same person a couple weeks, a month down the road when they are ready for treatment and to really face their addiction and try to get their life back on track. That's what I find the most meaningful is meeting people where they are, and then when they're ready, we're here to help them get treatment. A healthy Polk County to me down the road looks like where we're working in collaboration and not in separate silos within the county, and that treatment is accessible, and that treatment is not just for the individual who has the disease, the substance use disorder, but also for the families that have been impacted on that. And I think the healing of the individual has to go along with healing of families and healing of the community for us all to be healthy.
Access to health care is only one part of stability. For many Polk County residents, a legal issue can unravel everything. Family, income, housing. That's where Pisgah Legal Services steps in.
My name is James Gorsuch. I'm a managing attorney with Pisgah Legal Services. So Pisgah Legal Services is a nonprofit law firm. We provide legal aid services in Western North Carolina. We're the only provider in most of our region that does civil legal aid. And what that means is we work on all kinds of legal needs that address people's basic needs for folks who otherwise could not afford a lawyer. For people who are being abused and need safety or might need help with custody of children when fleeing an abusive situation. People who need access to public benefits. We provide those services. Is that everything that Pisgah Legal Services does is free. We do not charge for anything that we do. I'm born and raised right up the road in Hendersonville. Been coming down to Columbus and Tryon my whole life. And I think the two things that really give me hope in doing this work, one is the people I work with. The people who are doing this work are so dedicated and so skilled that we are able to provide, I think, a really high quality service to the community. And the other thing that really gives me hope is just the community that we work with. Having grown up here, having lived around these folks my whole life, I know how resilient this community is. And being able to be part of that solution, to be part of helping people get from a need to getting past that challenge is really something that gives me a lot of satisfaction and makes me really hopeful for the work that we do.
Mental health touches every family. And for many in Polk County, knowing where to turn can make all the difference. NAMI South Mountains is one of those resources.
My name is Matt LaBreche. I am the Executive Director of NAMI South Mountains. That's the local NAMI affiliate that covers Polk County. We actually cover 6 counties in Western North Carolina, Polk being one of them. So I think that understanding mental illness in the community is really significant because it touches everybody, right? I think that, there's not many of us out there that haven't personally experienced mental illness, either with ourselves, with our loved ones, with our friends, family. And I think that, if we can have a good understanding of what goes into getting someone in a place of mental illness, we can work to best support them to kind of help walk through that time in their life to come out more positive on the other side of it. So my background is as a pharmacist. I graduated from UNC in 2004. Been practicing as a community pharmacist ever since, but when I moved back to North Carolina with my family, I saw the damage that had been caused by mental health, particularly addiction and substance use in the community, and so I felt like the unique perspective that I have that I could bring to our community to see how medications and chemical components play into addiction could be helpful in coming out of that as a community. My role as the executive director for the affiliate is to try and identify people within the community that both need our services and also who might want to provide the services, because it is a grassroots organization. You know, it lowers the barrier for access for people to be able to actually connect with us and receive the help that they need. I got started in mental health for a number of reasons. I personally have struggled with my mental health, with the stresses and everything in life, negative coping mechanisms that I've personally used, and fortunately I had a wonderful support system around me to kind of help grow out of that. And you know, as I moved back to the area, I realized that not everybody has that support system, and I felt like I could lend my voice and lend my experience to the process of helping people kind of find out how they can get connected and see the value of connection with other people to move through their struggles. I've realized that there's a lot of people that are out there wanting to really to help with mental health and substance use. I think that what I have to say to people is if you want to find some support, or if you want to offer some support, NAMI is a great way to plug into that and offer what your experience might be to help others.
I'm Rob Parsons. I'm the pastor of Withall and Saluda United Methodist Church. I also serve with For All. So what's most important that the church can do is to be connected to people, know how people are feeling, understand their circumstances, sometimes advocate for them, and sometimes just help out, just like a good neighbor does.
So tell us about For All. Is that a way to connect?
So For All is a recovery community center, and it's designed to help, it's for all people who are in any kind of recovery. So it's mainly looking at mental health and substance use recovery, but it might be grief or recovery from trauma. And so we have ways of training folks to help everybody be better at being a good neighbor, help everybody be better at doing the things you really already know in terms of how to take care of each other.
Law enforcement has always been a thread in Polk County's safety net. Police Officer Justin Queen has seen firsthand how crisis response has evolved, and when a community shows up for its people.
My name is Justin Queen. I've been working for Columbus Police Department for almost 6 years now. This is my first law enforcement job since I graduated college. And I'm a senior officer here at Columbus. Just in terms of promotion, the amount of time I've been here, my training experience that I've gotten since I've started working, including my bachelor's degree. What I've seen here in Polk is definitely not a lack of people that want to help. The professionals, again, talking about those civilian positions that we have and resources we have in the county. A lot of good men and women that want to help, want to provide services for people that are in substance use, addiction, or mental health crisis.
Where law enforcement ends, healthcare begins. Advent Health's Polk Behavioral Health Team works at that intersection every day.
My name is Catherine Lowry and I work at Advent Health Polk. I am the Behavioral Health Program Manager and the Family Medicine Manager at Saluda Family Medicine. The behavioral health services that we are offering with Advent Health Polk is telehealth psychiatry services offered outside of the Saluda Family Medicine Clinic. We're offering telehealth psychiatry services as well as telehealth counseling for mental health disorders. Those can be accessed either outside of our Saluda clinic or can be accessed from the comfort of the patient's home. I also oversee our intensive outpatient program called Senior Life Solutions, which is for older adults struggling with mental health conditions, either depression, anxiety, grief, loss, emotional issues. So those are our two main behavioral health programs that we serve at Advent Health Polk right now. On a daily basis, I feel like I am battling the stigma of mental health for people that are clinging on to this idea that they don't need any help, that they can do this, that no, it's not anxiety, it's just a little stress, or no, it's not depression, it's I'm just going through something and it's temporary. But yet I will see these same people coming in and out of our clinic. We will see these same people coming in and out of our ED. And really to the point where, to the point of no return sometimes. And there's, the stigma is so real, it's so pervasive, that there's gotta be a way that we could break through to be able to reach these people and to know that we're all human underneath it all. And these feelings of anxiety, of depression, of mental health struggles is a human condition, and we're all struggling it to some degree together. And my goal and my role is just to normalize it a little bit, that we're all struggling. This is, life is not easy. The first thing I do with a new patient is sit down and just try to relate, try to connect. I want to hear where they're coming from. I want to hear about their family. I want to hear about their interests. I want to hear about some of their struggles, but I want to connect to them as a human. I don't want to connect to them. I don't want to hear about their disease. I don't want to hear about their prior diagnoses. I want to connect to them as a human. And I think that's one way that we can really fight the stigma. I myself struggled with an eating disorder, an addiction, and mental health issues. Pretty severe issues to that effect, to the point where I was hospitalized and I needed treatment. It was to a point where I was almost without hope, and I felt so low that I wasn't sure I could get back up again. It wasn't until a counselor, a social worker, really extended her hand and helped me get up, 1 foot at a time. I owe her my life. I went back to school. I got my master's of social work degree. Continued on to get my license of clinical social work certification, and it's been a driving factor for me. The kindness that social worker showed me. I want to give back. I want to give back to other people, but mostly I want to show other people that in the darkest moments, hope is still possible. When you think it's not, when everything is telling you it's not there, sometimes you just got to lean on someone else to give it to you, and it's possible. Yeah.
We all know someone who's been through a mental health or substance use challenge. We all have probably lost someone or know someone who's been lost to a mental health or substance use challenge. It's unfortunately a lot more normal than people really understand. Coming into the health and human services piece, this health and human services world, I came from a background where I had seen people lost to mental health and substance use challenges, and a lot of the time this was a product of circumstances that were beyond their control. I really truly believe that people have the right to an opportunity, a chance to live a healthy and safe life. a chance to break free from stigma that surrounds their struggles and a chance to break free from those struggles through support from within the community. Our work is really characterized by community-based support that addresses a lot of different kind of angles. But I'm here because I really think people deserve a chance to thrive.
I've always fallen back on when you see a need, you fill it. And with this project, I'm hoping that we will do just that. But even with Health and Human Services, that's what we do, is we connect individuals to essential services that are needed to be able to have a quality life. With my department, what we have tried to do is enhance our services, expand our services, so that we can continue to help people to get those services that they need. So it all falls back to being a servant, to be of service to others, and being able to help those who can't really understand how to navigate the complex systems that are in place, how to be able to do that and get the service and the help that they need.
And through this documentary, we honor the work that takes place every single day that transforms this community. We want to take a moment to recognize Yannette Cisneros, one of the visionaries behind this documentary. The idea of bringing these community partners together, telling their stories, shining a light on all the available resources, grew out of a commitment and passion of people just like her. So Yannette, as you embark upon a new chapter, we want to thank you for your dedication and commitment to this documentary and the people of Polk County.